Healthcare systems across the world are facing similar challenges. To overcome these challenges, care practices need to change from acute reactive treatment to proactive health management centered around the patient. But what does this mean for patients and medical staff, and how does Philips support this change to healthcare? Meet Betty, a 72-year-old living in Liverpool. She's been admitted to the hospital twice this year due to complications from several chronic conditions. Betty has trouble keeping up with all the care advice from many doctors and nurses. Besides that, the number of medications she has to take now is overwhelming. During the last visit, her community matron mentioned the new supported self-care program that will give her the support she needs at home to stay healthy. Fewer visits to the hospital, less waiting time, and enjoying more time at home sounds very appealing. She decides to join. The first thing the new care team does to help Betty is to get to know her. Clinical information is crucial, but the team wants to know more about her motivation, support she has at home, and her social environment as part of the holistic approach this program offers. Betty is supported in formulating a personal life goal, one that will motivate her to follow the care program designed for her. Betty's goal is to get out of the house more. Based on this information, a risk model for Betty is created. This helps the team select the right medical and social services to reduce her chances of being readmitted to the hospital. With the help of Karen, her personal health coach, Betty gets ready to start her daily routine. The health coach is trained to help Betty trigger and sustain her motivation for self-management, to be her advocate and sparring partner, and to be the eyes and ears of the remote integrated care team. When Betty makes her first video conference call with the integrated care team, she feels very excited about the advanced program she's now a member of. The Self-Care Hub consists of a care coordinator, a clinician, a social worker, a pharmacist, and a registered nurse, who work together to coordinate the patient's care. At the Self-Care Hub, Betty has become one of the patients the integrated care team reviews during the multidisciplinary rounds. Using dedicated IT solutions, the team can spot the patients in their group who require immediate attention. These can be patients whose health is deteriorating, or patients a care plan needs to be created for, like Betty. Each patient is different, and each gets a personal care plan. For instance, Sarah gets automated coaching, while Robert needs personal attention. Mark gets a remote consultation, whereas Betty gets occasional visits from her health coach, Karen. After catching up at Betty's home, Betty and Karen review the care plan and discuss the community service options available to her. Betty uses a personal health tablet and monitoring devices, such as a blood pressure meter, to help her and the team manage her medical conditions. A medication dispenser helps her keep track of her medications. She also follows an activity program with remote coaching that allows her to exercise around her home while feeling safe. At the Self-Care Hub, the team can follow the effects of the care plans and specific interventions using their patient population management tool. In addition, the team uses tools to continually analyze the root causes of events to identify where things can be improved to achieve better outcomes, both for individual members and for the program in general. Over time, Betty has been able to achieve her initial personal goal. She is more independent and is able to start walking outside again. We expect that by using this program, Betty and many other patients like her will be supported in managing their health from the comfort of their home, so they can spend less time in the hospital and more time doing what matters most to them.